Mel, we have to tell our listeners what the common signs and symptoms of oxalate are.
Okay, so there is a huge laundry list of what it could be. It affects many body systems. Oxalate can get into any organ system in the body, any tissue. So they can be really far reaching. And I like to stick with the most common ones because some of these other ones, it could be, it couldn't be, it might be something else. But the main things you want to look for is anything to do with the gut, anything to do with gut pain, especially. It's going to be a sharp pain. It's not going to be a dull nausea. It's going to be a sharp pain. Might get loose stool. Sometimes it feels like you're getting a stomach bug. You know, when you get a stomach bug and you get those sharp cramps, you get that. Sometimes they go a very yellow color. They might be quite acidic. So you might get a little bit of burning when you're emptying your bowels. Sandy grittiness in the stool or black or white flecks. That's when you see it. Now, the thing about oxalate, we can talk about it later. It's a bit cyclic, so it's not going to be necessarily every day. Depends on how much you're having. And if you don't even know what an oxalate is, you wouldn't know what your intake is. So there's that. Urinary, so someone who has frequent UTIs, interstitial cystitis, even thrush, especially I get a lot of women coming to me say I have recurrent UTIs or recurrent thrush, but they're not getting tested. So they're basing it just on the symptoms. It's the discomfort. It can be anything from quite intense sharp pain to just mild discomfort in anywhere in the urinary tract.
Do you see the women that go and have swabs done and then never have an infection? It's just inflammation coming from oxalate for UTIs. That's classic.
Yeah, quite often. Sometimes it can be like an embedded infection. But yes, if you're finding that you're either not testing or you're getting a test done and there's nothing coming up, I would really strongly suspect oxalate. So anything to do with the kidneys, the bladder, urethra, vagina, or any sort of discomfort. You might have discomfort during intercourse, burning urination, frothy urine. You might actually even see little flecks in the toilet bowl after you've emptied your bladder. And then you might see musculoskeletal stuff. So joint pain's a really big one. So people might get really tight, sore joints to the point that they think they've got arthritis. But it might not follow that pattern of arthritis. It will be very relapsing, remitting. Sometimes it's really bad. Sometimes it's not too bad. It will move from joint to joint. Muscle pain or stiffness. You might get grittiness or irritation in the eyes, rashes, even osteoporosis because the impact it has on the minerals. You might see early onset osteoporosis, but you just have to think that when this oxalic acid combines with the minerals and forms these crystals, it's like shards of glass. So anything that you can imagine that would feel like shards of glass in your body, then you can assume that it's to do with oxalate. I have seen a lot of people with things like cysts that have cleared up. So potentially having things like cysts in the body, because when you think a cyst is just the immune system surrounding something that it doesn't like to try and protect the body. So quite often you could have oxalates in those cysts, which includes like ovarian cysts and things like that.
Wow.
Yeah,
Wow.
it can really affect any part of the headaches. The most common ones, if someone came to me with those, I would really suspect oxalates. The other ones, I would only really kind of tie together if I'm seeing those main three category of symptoms. Fatigue's also really common, and exercise intolerance because the mitochondria gets affected. So, you get a lot of fatigue. Maybe one day you've got a burst of energy. You go and do a workout and then you're bedridden for 2 days. You can't recover. That's really common as well.
Yeah, interesting. And Mel, what are all the histamine symptoms?
Histamine symptoms. So yeah, your hives, your headaches. Whenever I talk about histamine, I say to people, you ever think about getting a mosquito bite or having hay fever? That's histamine. Anything kind of itchy or irritable, you'll see that. So
Yeah.
you also get the neurological symptoms that can come with histamine in the central nervous system. As we said, the headaches, the migraines, dizziness.
Yeah, it's so interesting. When I speak to my patients about it, they're sharp crystals and they are causing chronic inflammation.
Oh, absolutely. Most of the time, I would say people who, once we figure out it's an oxalate issue, who initially think they've got a histamine issue, they do have a histamine issue too. But
It's a symptom.
they find the histamine symptoms are lesser. So they might go, I still can't have fermented foods or red meat, but I actually can have pumpkin and banana. Whereas previously they couldn't have any of the histamine foods and they were still symptomatic.
Yep.
It's kind of like the histamine's more of a secondary
That's right. It's a symptom.
presentation.
It's a symptom of the oxalate. Histamine's always a symptom. When I'm looking at organic acids test, or if patients come to me with a whole bundle of tests and they've done organic acids and I see high oxalate. So we stop